My name is Wendell Potter. For 20 years, was a health insurance company executive. I ran the communications departments of two of the largest health insurance companies in the world. And part of my job was to mislead the American public. I switched sides because I became aware of the harm that I was doing, the consequences of the misinformation, frankly, the lies that I and others told to the American public and to policymakers. I became disgusted with what I was doing. I came face to face with people who were victims of our dysfunctional healthcare system, people who were having to get care in barns and animal stalls. That broke my heart. It changed me when I saw that. My biggest regret is that for so many years I was protecting a system that resulted in people dying prematurely. People not getting the care that they needed. And I say that a lot of the work that I'm doing right now is to make amends for those years that I did that. The role that I played in the playbook was to help design it and to carry it out, to make sure that people were confused about our healthcare system. We manufacture fear through the playbook. We try to make people believe that any kind of healthcare reform proposals are designed to move us towards socialism, to have the government take over our healthcare system. Those terms are specifically chosen because, at least Americans in particular, are concerned or afraid of anything that might be socialism. In the 1990s, that was when I first began this work to try to bamboozle the public. We had a series of commercials that were extraordinarily effective. They featured this fictional couple sitting around a kitchen table. Their names were Harry and Louise.
Having choices we don't like is no choice at all.
And you saw them expressing concern and worry about what might happen if the Clinton plan was passed. And that's just an example of how you use fear, uncertainty, and doubt to get people to believe certain things. And it was very effective. By the time that campaign was over, people were very much against the Clinton plan.
I don't know how passing health care will play politically, but I know it's right.
Canada is one of 3 countries in the world that has a true single-payer healthcare system. The other 2 are Cuba and North Korea. So think about what kind of healthcare you get in those countries.
We would often cite Sally Pipe's work because she was a reliable critic of the Canadian healthcare system. The impression was that we wanted to create, and she helped with that, was that Canadians have to wait endlessly for care that they need. That patients are literally waiting and dying on gurneys and in hallways at hospitals. That's the impression we wanted to create in Americans' minds. And in my old job, I would send reporters links to some of the work that she and her organization had done to try to even persuade the news media that the Canadian system is far inferior. I was quite willing to accept that what I was saying, what I was telling to reporters and others, that was fair and factual information. I became to obviously realize that that was not the case. These companies are not honest. I know from 20 years of working for them that they, as I used to do in my old job, will say anything to try to generate goodwill and to make the media and the public think that they're essential and good actors. They're not in many ways. It makes me sad and furious, to be honest with you, and more outraged that we have allowed this system to continue, that our policymakers, our lawmakers have in so many ways and so often turned a blind eye to the reality of our healthcare system. We should not have a system in which people are losing their health insurance when they lose their jobs, have to worry about picking up their prescriptions and not having enough money if they do to put food on the table. But that's a choice that Americans have to face every single day. Many people cannot afford even their co-payments, their deductibles, before their insurance kicks in. So we have millions of Americans who have filed for bankruptcy, even Americans with insurance, because of all they have to pay out of their own pockets before their insurance kicks in. It's a horrible, horrible system. An untold number of people have died, including people who have insurance, because they cannot get the care that they need, even if they're sending their insurance company premiums every single month. There's no assurance that they'll be able to get the care that they need when they need it. The insurance industry has erected so many different barriers that keep people from getting the care that they need. The health insurance industry, first of all, is completely unnecessary in this country. They have assumed the role of gatekeeper. They've seized power over the past several years, and they call the shots. They call the shots when it comes to us getting the care that we need, and they call the shots in Washington and the state capitals through all the money that they spend on lobbying and through campaign donations. So they've got a lot of politicians in their pockets. The system can and it must be fixed. It can be fixed if our policymakers, particularly in Washington, move forward to create a system that is more fair, make sure that everyone, regardless of ethnicity, of gender, of age, get the care that we need when we need it. Medicare for all is one option that has wide support among the public. We have a program that's been around for more than 50 years that operates much more efficiently and fairly than private insurance companies. I started supporting Medicare for all, frankly, when I became aware of how this system is harming businesses in this country. I've talked to so many business owners and business leaders about how our current system has just become unaffordable for them. So we need to have a system in which everyone has equal access to care. Everyone is covered, no one is left out. But we need to have a system that costs far less than the current system, and we can achieve that through either Medicare for all or moving in that direction with a viable public option and some other reforms that would curb the power and influence of the insurance industry.